Okay, well, whew, that was good learning all about the kidneys. But now I have a very special guest this morning, Frank Musumeci, who is the physical. It's like the guru of all physical therapists, and I am so amazed by him. It's one thing, Frank. Thank you for joining us this morning, but I'm so. Physical therapy is an interesting field. For years, people thought that physical therapy was just because you have a hip replacement or something, you need to have physical therapy. But you're really into something in a much higher level. I know I've met you through a lot of personal things, but Predisposition Longevity Spa and places like that really have gotten into the inner workings of what physical therapy and all the benefits are. So why don't you kind of give us an elevator speech of what you do?
Okay, well, Anita, if you don't mind, I'll start with a little background. I was practicing physical therapy for 27 years, and I was fortunate enough to start with a guy named Dr. Charles Virgin, who, by the way, South Florida just lost him the other day. He passed away.
You don't know this, but I knew him years ago from Miami.
Okay, well, everyone knew Dr. Virgin. Dr. Virgin was a Miami Dolphins team physician and spent a lot of time in the public eye, was a terrific orthopedic surgeon, a dear friend of mine and a mentor back in the early 80s. Gave me an opportunity to work with NFL players and was just a terrific experience, and I'll miss him tremendously. After that, I went to run a private practice called the Sport Clinic for 24 years. What we came to learn in that practice was this. A large percentage of the injuries we were treating, post-operative injuries, were largely preventable if people were not exercising incorrectly for their particular age, their posture, their past and current medical histories. So Dr. Harlan Selznick, who to me is the premier sports medicine orthopedic surgeon in South Florida, he talked to me about 15 years ago and said, Frank, he said probably 40% of the patient load we treat and I take to the OR are people who are exercising incorrectly. So what was born of that idea, Anita, was how do we morph this into a prevention strategy rather than crisis management? So physical therapy is an excellent profession, but what I've shifted my emphasis to and partnered with Predisposition Longevity Center in was prevention. So what they did with me is they brought me in about 10, 11 years ago, and I lecture about the aging process of the musculoskeletal system. And then we talk about a biomechanical or structural approach to prevention. Therapy is a great field. But what I'd prefer to do at this stage in my life is help people prevent from becoming orthopedic patients by making proper fitness choices based on their biomechanics.
No, Frank, every large condo community has a big fitness room. Mm-hmm. And you walk in and you see all these machines. And I know enough to be dangerous to know don't get on them without somebody that really knows what you're talking about. And a lot of those people who come in that say they know don't know.
You know, it's incredible you say that. I'm also contracted with Ocean Reef down in Key Largo. They have a terrific gym and a terrific staff as well. They bring me in to lecture approximately once a month during season to talk about biomechanically correct choices. And they have a terrific staff there as well. And then I started speaking at Williams Island recently for the same reasons. So exactly what you said has become the target-rich audience. And what I mean by that is baby boomers and seniors. We really, at this stage in our lives, have to make choices, exercise choices, not based on the latest fitness trends. And more importantly, not based on performance enhancement exercises. Now, the reason I brought up my past is that, you know, if you work with NFL players, if you work with highlight players, if you work with athletes, you're trying to squeeze the most performance out of the human body in a short period of time. But for us boomers and seniors, it's about longevity. So you have two sets of goals, and typically those goals are inverse to each other. In other words, the most amount of performance does not translate into the best longevity. So we try to make people take exercise choices that are, and I use the term free exercises. Free exercise to me is an exercise that you can still develop muscle physiology, bone density, postural goals without paying for it with your connective tissue. And that's a big, big paradox between that and the fitness community. So this fusion between fitness and therapy is really more where I'm at. Trying to make choices where we don't wind up with people having to have knee replacements, having rotator cuff tears, ending up with complex lumbar fusion surgeries because they did it from an exercise-induced mistake.
But when you say that, and let's just take this back to the typical person who sits and watches TV and is not exercising, that person needs to do something.
Oh no, well, when we look at exercise, I don't know if people look at it analytically. People make emotional decisions about exercise. When I talk to people mid-50s, mid-60s, we have to talk, what are our goals? Let's start with goals before we make choices. And first and foremost, I think most of the countries are aware of cardiovascular goals. So we have to make some choices on cardiovascular exercises. And then those are not one size fits all. Some people may have already stage 3 degenerative joint disease of the knee, and maybe a particular exercise piece of equipment may not be good for them. Another one may be well tolerated. So we start with things along those lines. We also know that sarcopenia, loss of muscle mass, is normal each decade of our lives based on hormones, growth hormone, and all the other metabolic factors. So we want to offset sarcopenia. How? By strengthening muscles, right? Muscles strengthen in response to stress. Bones do the same. Osteopenia, osteoporosis. If we're not stressing our bones and we're staying in partial weight-bearing environments and we're not really putting stress on them, we're mechanically not stressing the bone, and now we're subject to those problems. So right off the bat, we start with a few problems. If someone's not exercising, they're becoming deconditioned cardiovascular-wise, we know that. Bone-wise, that's a problem for people. Obviously, muscles, then they go ahead and they want to recreate. They want to play tennis. They want to play golf. Well, one of the things that opens people's eyes is you explain to them the biggest difference, Anita, between a professional athlete and a recreational athlete. And we have a ton of recreational athletes in South Florida, seniors who come here to recreate. Those people don't understand one big difference. A professional athlete exercises to play the sport. A recreational athlete believes the sport is their exercise. Well, in essence it is, but it's also a mechanical stress test for which you should train so your body can withstand those stresses.
So jumping forward on something, couldn't wait for you to come here because I was going to ask you, can someone get hurt swimming?
Oh, absolutely.
Really?
As a matter of fact, if you just look up the term swimmer's shoulder is synonymous with rotator cuff impingement syndrome, which can lead to rotator cuff failure. So the illusion that water is safe solely because it is what we call isokinetic resistance. And that basically means that the more pressure you put in, the more it resists you in net resistance. But that by itself does not make it safe for everybody. There are people with a predisposition to rotator cuff impingement. In orthopedics, they classify their shoulders based on acromion types. People with a type 2, type 3 acromion, they're not great swimmers. So we would advise against it for them. We may have them do aqua jogging instead, for example. In the Predicament Longevity Center,
you call it aqua jogging?
Aqua jogging is actually the use of a belt. There's an aqua jogger belt, okay? And the people remain suspended, say, in the deep end of the pool. Their feet are not touching the ground, and they're actually jogging just like they would if they were land-based. The beauty of this exercise is they can wear a friction shoe. They can wear a heart rate monitor. They could be running unweighted. Now, if you have people with degenerative hips, they have typical compressive lumbar stenosis, these people tolerate this exercise very well, as where land-based exercises they may not tolerate well. So once again, you can't make a generic statement where you say that swimming is good or bad. There's some great things you could do in a pool, albeit the problem is we do not get balance from it and we don't get bone density. So now you have to think about, if we're not getting balance, we're not getting bone density, and we're only water-based, how do we get that in a land-based exercise? Because I was mentioning before, that to me there's basically 5 dimensions to wellness, structurally speaking, or I should say in a systemic manner. We talked about cardiovascular, we talked about bone density, we talked about loss of muscle. Structure is very important. Is the pelvis in neutral? Do we have a spine that's in kyphosis? Do we have forward head posture? These postures predispose us to orthopedic problems. So structurally, you want to get the spine in neutral. That's number one. Secondly, the central nervous system, in my opinion, has been the one that's most ignored by the fitness community. When you think about your body, unfortunately, our bodies do decondition, and they decondition slower if we train them. So in sports medicine, we have a term called sports specificity. You train the body at what you want it to do. If you have someone who's a hiker or a tennis player, they should be doing exercises that mimic the toughest things, deceleration. So eccentric loading, we call it in orthopedics, strengthening someone in eccentric motor patterns. These things have carryover directly to what they're trying to do to their body, and therefore they can do it better. Balance is an important thing as we get older. Fall risk, as we get much older, becomes a very significant exercise goal. Medicare even recognizes people as a fall risk and will pay for therapy because of it. We prefer people not to fall, not have to be in a rehab center, not to have broken hips and all the like. We prefer that they not fall. So in a prevention setting like the Predisposition Center, we try to address all of this. We try to address what are their risks to fail structurally, orthopedically, not just cardiovascular, not just nutritional, which is something they also specialize in.
So you're saying, in essence, let's not people just kind of take a chance. They go from year to year, and if they don't fall, then they're doing okay. But what you're saying is this is prevention. You're looking to help prevent them from ever falling.
Isn't this something that's overlooked? What I try to
Absolutely.
say is, let's draw a parallel here for a moment, if we could. When you look at cardiovascular, or let's say cardiology, in my lifetime, cardiology really has done something well. They really have shifted their paradigm from crisis management to prevention. My grandfather had a heart attack in 1967. He was almost 67 years old. At that time, he wasn't a cardiac patient. He hadn't seen a cardiologist. Now, once he survived this heart attack, luckily, he was now a cardiac patient. Today, if you look at cardiology, I think the standards of care is that by 50, you should be assessed. You need to look at blood work. We're looking at triglycerides. We're looking at all these lovely things to make sure you're not having that event. And there are even interventions before people have them, right? They're putting stents in. They're doing things. Now, let's just say this. It's great that they're shifting the paradigm to more prevention and not just waiting for the event and then trying to save their lives. Unfortunately, in orthopedics, what became strikingly evident to myself and my wife, by the way, who's also in outpatient orthopedic therapy practice and prevention with me, we find that people are failing and then we're seeing them. So the Predisposition Center was the first place that really embraced the concept of injury prevention, orthopedic wellness, and that's why I've been lecturing with them, and I've been a consultant to them for 10 years, and we've grown this program dramatically within Predisposition, and now it's expanded beyond there.
Okay, Frank, so let me just introduce you again. This is Frank Musumeci. How am I doing?
No, that's about as good as I could say it. Yes, Anita.
Okay. And he's really senior strength training specialist, a licensed physical therapist, certified personal training, a biomechanical consultant, and lecturer at Predisposition Longevity Spa, among other places. The reason I brought him on is because there is so much confusion about what people should be doing. See, people say, oh, I'm going to get 2-pound weights and I'm going to sit there and work on the weights. And after I spoke with you, I thought everything was dangerous unless you knew what you were talking about. But my concern is, here you are, we can't clone you. So is your job really to train trainers so that they can know what you do so they can then help people? Because we can't have you everywhere.
Interestingly, it's funny you say that. I've talked with an exercise company about making certifications in this manner too. And what we have is this. Yes, we have young, well-intentioned personal trainers out there. And I happen to be a personal trainer. My wife and I have a personal training corporation. One of the things we need to do is this. We need to get a little bit of orthopedic knowledge to our trainers, in so much as to get them to understand there are what we call orthopedic contraindications. So if I'm going to talk to a trainer who's going to work with a client, I may ask them just a couple of quick questions. What are total hip precautions? What's an anterior hip approach versus posterior? What's a Bankart lesion in his shoulder? What's a spondylolisthesis, and what would you do to prevent provoking the problems with it? The problem is, if they don't even know those things, they may not be qualified to work with the aged population. So this concept of screening people orthopedically and biomechanically before making the exercise choices, I believe that's going to be the future, because to keep letting them fail in a gym and then bring them to the OR, it's not only is it painful, not only is there downtime, not only are there comorbidities and problems associated with that, but moreover, it's breaking the bank. So I think this concept of widespread structural orthopedic knowledge fusing with fitness, I have a vision that would be something that would save an awful lot of money and an awful lot of time, and more importantly, human suffering. And I think that would be the most important thing that can come of all this.
Frank, it's the first time since I met you that I've heard about this. Because when we think of people who've had hip fractures or they've had replacements of knees, they go to a center, and they have physical therapy, they have occupational therapy, and then they go home. And now, maybe those physical therapists know what you're talking about, but I would dare say a very small percentage, if any. And so this is real cutting edge stuff.
Well, Anita, here's the big difference. We use a term today called sports medicine. You'll see it on almost every building, okay? Most people, when I ask the therapist even, I say, do you really know the difference in the definition between straight physical therapy and sports medicine? Well, here's the way it really is. Physical therapy, technically, if you want to define it based by Medicare, which kind of sets the guidelines for everything, physical therapy is the practice of getting someone back to being fully functional in their activities of daily living. So if you have a hip replacement patient, you want to get them back to full weight bearing. You want to get their strengths within normal limits. You want to get their balance to be safe. You want to get them able to walk, dress, shop, shower, drive, go up and down stairs, take care of themselves, and be independent. That would really be the goal. Sports medicine is very different. Sports medicine is about getting people back to the level of function that was a sports medicine goal. That may be tennis, for example. There's a big difference between driving your car, going up and down a staircase, and being able to safely and play tennis well. Now, what does that mean? Why do we care about this? Because many of these are aging people down here. They didn't come to South Florida to die. They came here to retire and have an active lifestyle. So they came to play golf. They came to play tennis. What we need to do is we need to incorporate sports medicine into the fitness community because it's not really medically necessary. The government's becoming more and more aware of we can't treat people too long. We can't overutilize the service. The government's not responsible for people to play tennis and golf. They're responsible to get them back to independent living. So here's where our problem is. Many people think I can go to therapy and then I can get back to playing tennis. But no, they really need to have a fitness person who could take them to those final stages. And that's coming out of therapy field now and going more to fitness. And as that's happening, as these cutbacks come, we have to get the fitness people to understand how to do this a little better.
That's excellent. That's what you just said. From physical therapy to fitness.
There's the big bridge that we're trying to build. But not necessarily
sports fitness. And that's, I was thinking like LeBron James. Now, that's sports medicine, what we have to do with him, right?
Yeah, well,
compared to Mr. Smith, who's 85 years old and he's just come back from a hip replacement, and yet he wants to be able to go with his friends and do things, right? That's the difference.
There is a big difference, and I have to tell you, LeBron was lucky to move to South Florida for one big reason, whether he realized it or not. Their team physician, Dr. Harlan Selznick, I rehab patients for him in the past. I'm no longer in that practice, by the way. But for 27 years, I worked with his postoperative patients. He had tremendous results. This guy, tremendous. All that said, it's good to have Dr. Selznick. As a Heat fan, it's great to have Dr. Selznick as the Heat team physician.
I saw the recommendation letter he sent you. I was very impressed, Frank, actually.
Well, we worked together a long time. We got to know each other from Dr. Charles Virgin's practice back in 86, 87, and we worked jointly with patients for many years. And he is a tremendous orthopedic surgeon and a terrific guy.
Well, let me ask you a personal question for yourself. When did this all come to you, that there was more than just being a physical therapist or a fitness trainer?
I was at a fundraising dinner with Dr. Selznick on Miami Beach, Big Brother dinner. And he said something to me that night, something about we were getting most of our patients now from personal training clients that something had gone wrong. And my wife and I had the same observation, and we would take people's histories and say, you were doing what? Why were you doing this? And, well, they do this or this one. Wait, but did you know, you had a lumbar fusion or you've had a hip replacement or you have degenerative patellofemoral disease or you have a partial rotator cuff tear. Why were you military pressing? Well, because, this is what I was told to do. So what happened was, out of this, my wife and I talked about it. We talked 3 nights a week at the dinner table about, you should hear what happened to my patient. They were trying to get into shape. They were seeking a level of fitness and wellness, and then they were ending up in an operating room. And this paradox just kept smacking us in the face. There's another, by the way, excellent young orthopedic surgeon named Stephen Gorin in Aventura. And Dr. Gorin and I have sat and had lunch, and we talked about this over and over. And I don't want to throw anybody under the bus here, but we talked about some of these fitness programs that are out being sold on TV today. We're like, could you imagine a 62-year-old doing that? I can understand it if it's a 21-year-old NFL running back recruit and he wants to work and do plyometric training and heavy muscle confusion. But if it's a 68-year-old with this, when you watch what they do, it's an absolute slam dunk. They're going to the OR sooner or later if they keep doing that. So when they walk in and they look at the equipment, we want to give them an education as to what should be their goals structurally, what should be their goals. And it's individual. It's kind of hard to do that. The other thing that's most interesting to me is I've been now talking with the biomechanical engineer for Cybex. And Cybex being one of my, I just have a real respect for what Cybex does with their equipment. They have a whole biomechanical engineering department devoted to making equipment biomechanically correct. And the reason I'm so high on Cybex is because they came exactly like I did. They came from the therapy, orthopedic realm. That's what they were focused on. They made rehab equipment. And what they've done is they now take their equipment and they've taken it to the fitness field. And they're spending inordinate amounts of times. They're partnered up with, I believe, UMass, University of Massachusetts, and they have biomechanical engineers, engineering students, and they work on stresses and ratios of strength and friction coefficients and things that really make biomechanical anatomical sense. So somehow, some way in the future, the goal is to get this all together. People like Cybex, people like Predisposition, individuals like myself who've worked in the orthopedic injury field, and make this fusion so we could start getting people to have some concept of the do's and don'ts of making choices when they start exercising, particularly over 50 years of age.
I think the first thing, and I'm thinking about this as you're talking, is for education. Get people to understand this so that they demand it. They have to, understand that if someone's going to take them on as a client, that they realize that they shouldn't be embarrassed to say, I'm not going to do that. That's way more than I want to do, right? And so that's what we have to do. Is there a way, if someone wants to contact you, do you have a website? Yes. I think you have something. No,
actually we don't.
How should we do this?
Actually, no, we do not do a website at this point. As a matter of fact, that is something that my young daughter's been trying to make me construct, and I've still been doing things the old-fashioned way. I leave my head brochures with phone numbers and.
Do you know what you can do, everyone? You can call our office, and I'll get you in touch with Frank and what you might have for him. Let's do it that way. Should we do it that way?
That's fine. You can use the phone number as well. If
you want me to give your phone number out?
Oh, that's fine. Yeah, that's what I use it for.
I'll give you a phone number for Frank. If you have a group, you have a condominium association, you have something where you think you would like to talk with Frank, his phone number is 954-547-9347. 954-547-9347. I met Frank somewhere else, but he and I have come together in a way because I'm very, very high on the Predisposition Longevity Spa and a lot of the other things that Frank is doing, and hopefully we're going to work out some sort of a program. But it's called Prescription Exercise, which I think is wonderful.
Well, yeah, that was the concept my wife and I came up with over 10 years ago, was let's prescribe exercises based on orthopedic needs and goals. And I have to say, I'm also associated with Oasis Management Center, Aging Management Center. Dr. George Munoz, who's an aging management specialist and also a rheumatologist and a good friend of mine and my own personal physician as well. And Dr. Munoz also embraces the concept, and we do this over at Oasis as well. So there's many places we do these sort of things. We try to set this up, but we're trying to capture the population that is aging, but yet wants to be active, and at the same time doesn't want to have bad experiences with exercise. We're letting people have experience with exercise that keeps them from going to the gyms, and it's really quite a shame because they need to go, but they need to know how to make the right choices.
Well, Frank, it was wonderful having you on our show. I look forward to doing more things with you, and I hope our listeners have gained something from this. So caution. Let's be careful what you do, and let's make sure that you don't damage yourself and get yourself to the hospital. So thank you, everyone, for listening. We'll be back here next week, same time, same place. You can listen to 1470 AM on Sundays from 4:30 to 5 and then 7 to 7:30 in the morning. That's it for today.
Thank you.